Abby, how are you?
Good.
Okay, you remember me. I'm Essence. I'm your nurse for today again, but I'm just coming in here because your doctor gave us an order for your cefazolin, which is an antibiotic, is to help decrease infections, okay? So first, let me make sure that your bed is locked and at the lowest position. It is at the lowest position. You do have your call light right here. You have your bedside table. Your floor is clutter free. There's no water or spills on the floor. Um, you do have your call light. Okay, so your three side rails are up. Your bedside table. Okay, Miss Abby, so you're good to go. But first, let me do your patient identifiers. Can you give me your first and last name?
Abby Corlone,
Okay, how old are you?
25.
Do you have any known allergies, Miss Carlon?
No.
Okay, that's good. All right, your MRN number is 7852361. 7852361. So I see here for per provider's orders that you are getting your cefazolin 1 gram by IV every 8 hours, okay? So your cefazolin, like I said, is just to decrease in the your risk of infections, okay? All right, let me go to the MAR to make sure that it is the pharmacy did give the same as your provider's orders. So I see that you are Abby Corlon getting cefazolin right now at 4 p.m. today. You are getting 500 milliliters in a 1,000 milligram dosage. You're getting via IV Piggyback every 8 hours right now at 4 p.m. Okay, now I'm going to restate that. So I have Miss Abby Corlon, and I have the correct medication, which is cefazolin. I have the correct time, which is right now at 4 o'clock. I have the correct dose, which is 100 milligrams, and I have the correct route, which is IV Piggyback, and the expiration date is January 2023. Alrighty, so now let me go to the bar, and I'm going to scan your patient bracelet, okay? Alrighty, and now I'm about to scan your medication. Okay, I have scanned your cefazolin. Alrighty. So now, let me go ahead and set up your bag, okay? So I've taken my bag out, and I see that my solution is clear. The bag does not have any tears, and everything is very potent. So now I'm going to grab my tubing, and I'm going to make sure that my tubing is intact, and I don't touch this part right here to make sure that it is sterile. So I'm going to use a septic technique with this, and I'm going to make sure that my roller clamp is closed. So now I'm going to remove this, and I'm going to insert my spot using a septic technique also. And I'm going to squeeze the drip chamber. Alrighty, now it's time to prime my bag. So now I'm going to unclamp it and prime the bag. Not too much, I don't want to lose all my medicine. Alright, I have closed my clamp. So now I need to make sure that I lower my primary bag. So I'm going to hang my secondary bag right here, and I'm going to lower my primary bag. Oh, I dropped our bag. Oh, I'm so sorry. Okay. So now I'm gonna get my gloves to make sure that your IB site is still patent. Okay. So do you have any tenderness or anything?
No.
Okay, that's good. Y'all don't see any redness. Okay. So now I'm gonna grab my alcohol swab and I'm gonna find and clean this white port for 15 seconds. Okay, now I'm gonna insert this. Alright. And I'm going to start your secondary. So your rate would be, well, let me close this clamp. Your rate would be 50 milliliters. So your rate would be 50 milliliters. And your volume to be infused is also 50. And then I'm gonna press start. So now your secondary is now flowing. I'm gonna clamp your primary. And I'm gonna unclamp your secondary. Now your secondary is flowing pretty freely. And just let me know if you have any more problems. And I will gladly help you. Alright. Okay. Alrighty, Miss Cormon, thank you so much for allowing me to do your primary and secondary dripping. Now I'm going to label your secondary. Okay. Alrighty, thank you so much, and let me know if you need anything. Your bed is locked and it's at its lowest position. Your side table is here. Your call light is right there. And your floor is clutter free and all 3 side rails are up. So just call me on your call light right here if you need anything, okay?
Okay.
And I have documented that your medication was tolerated and that I gave it to you, okay?
Okay.
Thank you so much.
Thank you.
Alright. And now I'm gonna wash my hands.